Chris Bondick, aka The Resident. Stephen Malesko, narrator 2.
Kyle Kopatich, blind physician.
Livna Haddam, Sarah.
Brian Robertson, poor patient, and passive Sarah.
David Kerbel, aka intellectually and ethically sound Sarah.
Aaron Barnes, cameraman. Somewhere in Haiti.
Sarah is on a mission trip to Haiti. At the village clinic where she is working with residents to address the needs of patients, she notices that patients who come through who appear to be members of the local owing class are being treated significantly before poor people. She observes a woman who has an open leg wound who has been waiting for days to get her needs addressed.
When is she going to be treated? She's been sitting here for days.
You do-gooders come here from the U.S. acting like you know how we do things around here. I have 80 patients to see. I don't have time to babysit you and her. Whoa, whoa, whoa. Something's going on here. Even a blind physician can see that.
Oh, excuse me.
Hello, doctor. Could you tell us about how distributive justice relates to this scenario?
I'm not an ethics professor. I'm a doctor. Even I can see that.
Silly doc. Everyone should know about ethics. Distributive justice is the unbiased distribution of scarce resources among all socioeconomic groups and population sectors. Any society has a limited amount of resources. These resources get partitioned in each industry by the government. Examples of limited resources in the healthcare industry are money and pharmaceuticals.
That makes sense. But how could Sarah fix this dilemma?
I'm mad. I could be aggressive.
You do-gooders from the U.S. come here acting like you know what you're doing. You do good? I was like, you need to do some good, man. Who are you? What? Get out of here. What?
Wrong, Sarah. You should never use aggression towards a resident.
Well, I could be passive.
You do-gooders from the U.S. come here acting like you know how to do things.
Oh, I'm sorry, you're right. She'll have to wait.
That's more like it. Wrong again, Sarah. The patient's needs are important and should always be in front of your mind. Let's ask intellectually and ethically sound Sarah how it's done. You do-gooders come here from the U.S. acting like you know how to do things.
I didn't mean to cause any problems. Please forgive me if I've offended you in any way or caused you to lose time with your patients. I do believe that this woman has an open leg wound and is at severe risk for infection. If you would allow me, I would like to start prophylaxis for the wound infection. It may save us time in the long run.
Okay.
Wow, that was great. How could I have prevented that, intellectual and ethically sound me?
Knowing the method of distributive justice for a particular country is crucial. The case of Haiti is a bit muddled due to the devastating earthquake in 2010 and more recently the cholera outbreak that has absolutely ravaged the population. To prevent this from happening, I should have checked on the hospital policy about distributive justice. If there is no policy, which in many cases there is not, consult the physician in charge of such decisions to be informed of proper protocols to prevent unnecessary harm. And remember, when practicing medicine, always be your ethical best.